The world needs to move towards integration. We can all see and feel, even in our own lives, the pitfalls of fractured, fragmented care.
With so much that's unpredictable, one of the best things that we can do is really team up to try to address those things together in the long term.
I think the original vision for Team Up was to expand access to child mental health services at federally qualified health centers. There was a sense of promoting health equity and a recognition that the population served at the health centers often had difficulty accessing mental health services.
There was a deficit, kind of peer-reviewed literature that spoke to how to provide really high-quality, evidence-informed behavioral health care within the environment of pediatrics of primary care. There were not models to take off the shelf. It doesn't work to hand over a model to a health center and ask that health center to implement that model. The guiding principles of what it is that we're trying to achieve need to be the core essence of what everybody is signing on to do together.
The Team Up model really does a nice job in bringing the behavioral health side of things with the medical side of things, with the inclusion of BHCs and also with the inclusion of community health workers. The three roles together really have the opportunity to provide quality care, particularly for the marginalized, high-risk population.
This kind of research is not rocket science. Rocket science is way easier. And the reason rocket science is way easier is that it's more predictable. My hope is that Team Up can be part of the solution to really shifting toward thinking about the voices of all kinds of people from all kinds of different populations in a different way and really thinking about equity more deeply. There's not as much evidence on populations that have been historically oppressed in different ways. As a researcher, I think the clear imperative is to really deepen the evidence base so that we can say with more confidence what works for a very diverse range of people.
There's a lot of hierarchy in the medical profession, and I think that Team Up has consciously acknowledged that and recognizes it as something that needs to be addressed.
We have to look beyond traditionally trained psychotherapists, psychologists, psychiatrists, to look towards who are already existing role models in communities. The community health worker role that is part of the Team Up model is a really good example of this.
It's truly that human interaction, that therapeutic approach, and that ability to connect with families that's really truly going to make an impact on how we're delivering care and impact on the health outcomes for the families and their children.
I think it would be hard to do the work that we do without these spaces where we can do a mix of supporting sites individually and also creating spaces where people can just develop relationships across health centers.
Team Up has really been a wonderful platform, not only to directly change the experience of patients and families in Team Up health centers, directly change the experience of the healthcare team in delivering that care, but also through the learning that has happened through this initiative to work on changing at the policy level our expectations for what we would like our healthcare system to be like and how we would like it to function for all of us.
Some of the best examples of people, like the relationships that have been formed and people taking the supports that we've put in place and taking advantage of those relationships, is when I hear from practices that they're meeting together without us, and that's actually the best feeling.
I think the future is integrating mental health, well-being, therapeutic, social-emotional understanding into all of our infrastructures, into schools, and into our medical care, into our workplaces, into all the spaces that we share together. The bigger picture is how to set up structures that mediate stress and burnout and sustain us in a way we're more taking care of each other.
I think a lot about the next generation.
I think that it's clear, based on my experience here, that I definitely want to be in a place where the values regarding one's wellness and social connection and belonging is embodied by the people that you're working with, and also your coworkers and your supervisors.
I hope that any number of practices, federally qualified health centers, but also private practices, large health systems, are able to capitalize on the learning and the Team Up has made. If I was to go, 10 years forward, I would hope that the Team Up almost is such an established part of how we think about providing behavioral health care to children and families that maybe it's even an afterthought. It's just taken as a standard part of healthcare.